We all know that brushing and flossing are important, but what if everything you thought you knew about dental care wasn't actually the full truth? What if some of the most common dental practices, like using fluoride or getting root canals, are actually doing more harm than good? And what if there was a way to take care of your teeth that also supported your whole body? Today, my guest is Dr. Lauren Poole. She is on a mission to change the way that we think about oral health. She's a dentist here in Brentwood, Tennessee, just outside of Nashville. I actually go to her office, Sweet Truth Dental, and their approach is holistic. They focus on using safe, non-toxic products for whole body dentistry. And after years of being in traditional dentistry, she realized that many of the standard practices, like using fluoride, certain materials, even doing mercury amalgam fillings, that really were not actually helping patients the way that they should. So she dove into her own research and training in biological and functional dentistry, learning how to detoxify and reimagine oral care for a healthier family. As a mom of three herself, she's passionate about helping families make better choices for yours and your kids' oral health. And today we talk about everything from mouth taping to jaw development, root canals, fluoride, her morning and evening routines. We really get into it, and I ask her specific questions even on what optimal diets your kids should be eating for healthy teeth. We get into it so good. I hope that you enjoyed this episode, and I hope it gives you some encouragement around how to take care of your teeth holistically and maybe even go in to see Dr. Lauren Poole yourself. All right, let's get into the episode. Welcome to the Trust Issues Podcast, the show where we question everything society tells us about how to live, work, eat, and be. I'm Erica Auckland, a mom, entrepreneur, and advocate for living life on your own terms. Here we challenge the status quo, from the food we feed our families to the way that we build wealth and well-being. You'll hear unfiltered conversations with everyone from farmers, financial experts, and everyday people who are doing life differently, all with one goal: to help you live healthier, freer, and more abundant. If you've ever felt like there's more to life than following the crowd, you're in the right place. Let's get into it. Dr. Lauren Poole, welcome to the podcast. Thanks for being on Trust Issues.
Thank you so much for having me.
I want to get right into it. And hot topic that I see a lot of people talking about and battling over on social media specifically, but as a holistic dentist, what do we need to know about root canals?
That's it. It's a really good one, a very controversial one to start it off with, but it's a favorite topic of mine because I'm always a proponent of like arguing both sides. I like to explain what we used to think about root canals, what we think about them now, and my caveat for all patients is dentistry isn't and shouldn't be one size fits all. So there's a lot of different circumstances that can change the perspective of what the right treatment plan is for you. But what we should know, just to get started on what a root canal is a procedure done when the nerve has been affected in the tooth or infected, either one, meaning it could be trauma to the tooth that like severs the nerve of our tooth, or it can be infected by bacteria. Either one of those could kill the nerve of the tooth, and then the nerve needs to be removed. The removal process for a root canal, obviously, as we go on the inside of the tooth, remove that nerve tissue, and replace that with a material or filling material, and then usually put a crown on top of it. For an affected nerve or more of that trauma-related nerve, there can be trauma to a nerve that kills it that has no bacterial involvement. It's an important distinction for me when I'm talking to patients about root canals and whether or not they're going to have a good prognosis to keep in our bodies. And because the affected or the traumatic root canal, if there's no bacterial involvement, it's going to have a really low risk of having a chronic bacterial infection. Whereas a root canal done because of bacteria, or one that was a cavity that got to the nerve of the tooth, bacterial involvement that caused that nerve to die, has a really higher likelihood of having what we call reinfection. The idea behind a root canal is it's supposed to sterilize the tooth. So if it was a perfect procedure, you would think of a root canal as a calcium implant made of your own body's hydroxyapatite and calcium and staying in your body. So ideally, if that could be done well, or this sterilized calcium implant made of your own cells, sounds really great. But there's microtubules in our teeth. There's so many different areas where bacteria can hide. So the idea of totally sterilizing a tooth is near impossible when it comes to a bacteria infected tooth. So for that reason, a lot of times root canals, anybody who has an existing root canal, we have a lot of discussions in my office about it's a hard discussion for someone who comes in with 12 of them to be like, you need to go get 12 teeth removed because there's potential that they could all reinfect at some point. So it more becomes we need to discover if any of these are already reinfected. That's usually with a CBCT or a cone beam x-ray. It's a 3-dimensional x-ray we take of all of your teeth so we can see if there's any pockets of infection hiding around a root canal or another tooth. Some people have a dead tooth and don't even know about it. So the real controversial part to me is I think a lot of evil is placed around the root canal itself, but it's actually the chronic infection that's the evil part there. The undiagnosed or unfound chronic infection is the part that can wreak havoc on so many people's health. And we do often find in patients, they are having a plethora of health concerns and issues, and all of a sudden we find reinfected root canals. And the reason the root canals get the bad rep is the nerves removed, so their body's signal for infection, hey, something's wrong, is not there anymore. That was removed. So people go walk around with infections and don't know about it because their body's signal system has been removed. So that's the bad reputation of the root canal, whereas I always like to say the real evil there is that the chronic infection. So if we can do everything we can to prevent a chronic infection, hopefully we never have to have the discussion of root canal removals.
So good. What are some of the common health issues that you see related to these infected root canals?
Yeah. I usually describe it in a way that is chronic inflammation or chronic infection leads to chronic infection or inflammation. So it is so frustrating if you have ever had a health-related issue when you're trying to describe what chronic inflammation sounds like, because they all sound the same, right? It's like fatigue, just overall malaise, not feeling good. Some people have no symptoms whatsoever, which is wild. I always relate it to like a toxin. I don't know if you've heard of toxic bucket theory, where it's this idea that some people can withstand those toxins for a long time without any effect of it, whereas some people, just the moment they have an infection, their whole body breaks down. There's a lot of dermatitis, skin issues that'll show up in a lot of our patients when they have that sort of thing. There's also tooth meridians, so if you do like a deep dive into really more of that like Eastern medicine philosophies where the teeth are all connected electrically to other parts of our bodies. I have had a lot of patients just find that relation is really true for them. I've had a lot that also it didn't show up true for them. So that one's a hard one to be like every time number 2 is affected, you've got a liver problem. It's hard to always say like this is an always or never situation because I think it's so patient dependent, but I feel like a lot of women in particular will be, when they're coming in with undiagnosed autoimmune sort of disorders, it's one of my first things I look for.
So good. I mean, I'm already thinking I had dermatitis it was like a year ago. I'm like, oh my gosh, was that connected? That's so fascinating. So if someone has a root canal right now, and they might be noticing some symptoms, what should they do? And I also would love for you to touch on the difference, this is kind of another beast. We can get there in a second, but the difference between like a traditional dentist versus a holistic dentist and what you do specifically that is different, that how you might treat it would be different than somebody else.
Yeah, great question. I will say the way I would treat a root canal in general, or if somebody had one right now and they came into my office and they're asymptomatic and I'm like, okay, we still would like to take a close look at any root canal. We'll start by just taking the lowest dose radiation x-ray of that, which is just a periapical x-ray, check and see if there's anything kind of suspicious about it. If we find anything suspicious or a patient has any symptoms at all, we usually recommend a cone beam, which is that 3D x-ray. It is just going to be our quickest, most absolute way of finding any pocket of infection. Every now and then I get a patient who I will even say to them like, okay, you're having symptoms, we could order the cone beam and get that. But if we already know you're having symptoms and this tooth has a root canal, if we find it does have an infection, my only treatment plan for you would be to extract that tooth, which is, to your other question, different than what a traditional dentist may say. But if we already know we're going to an extraction for a symptomatic root canal tooth, sometimes I'll skip the extra radiation of a cone beam and just say, your tooth is symptomatic, it shouldn't be. There's no nerve in it, so it shouldn't have symptoms. The fact that it does tells us there's infection involved. You can kind of skip over that x-ray part and decide to get it extracted. And luckily, we are in the age of implants, and dental implants are come a long way. There's now ceramic implants. Those are biocompatible, so no titanium or anything in the mouth, and replace a tooth individually without doing harm to any other teeth. So that's really helpful. As far as my diagnosis of go get it extracted is different from a traditional dentist. Even when I was a traditional dentist, our first step would usually be recommending a retreatment of the root canal, meaning going to have that same tooth treated with a second root canal procedure, cleaning and trying to sterilize it out a second time. And a lot of that, I think, stems from the fact as a dentist, it's really hard to give patients the news that they're going to lose a tooth. So I think for a long time, this is me being like devil's advocate on trying to decide why we would choose that for so long, but it was, to me, the only thing that made sense is I hate telling someone they're going to lose a tooth. It's awful to tell them, sorry, you're going to be toothless in an area. So we try to do everything we can to save teeth, and I have found now on the other side of dentistry that that's to the detriment of so many people's health. And although the message is hard to deliver, I would rather deliver the right message, which is do not try to retreat a reinfected root canal. It's not a good choice.
What are some other points that you can share with us on what holistic dentistry is and what you do specifically?
Yeah, so my office, we kind of have a tagline that we say we detoxify dental products, procedures, and experiences. And the reason I say all three of those things is the products themselves is a good place to start. So even if you don't have access to a holistic dentist, you can make a lot of holistic choices at home on your own dental hygiene care. Fluoride-free toothpaste, you can ditch your mouth rinse. There's really no such thing as a great mouth rinse unless it is, we can talk about oil pulling and all sorts of other alternatives, but there's no real easy Listerine option that would be good for you. And yeah, there's certain things like the plastics in your floss that you can get rid of. There's a lot you can do at home. So we, in our office, provide products for sale if people want them. They are hard to come by. They're not easy to find everywhere, but you can online often find some of them. So we detoxify those products. Our whole office is fluoride free. So our materials that we do, fillings themselves are fluoride free. A lot of fillings in a traditional dental office will have a fluoride releasing product in them to try to remineralize the tooth from the inside. So it's constantly giving you a fluoride dose inside of that tooth. Yeah, so we are fluoride free. Our fillings are BPA free. So we're trying to cleaner products. And the procedures are cleaner in the sense that we do a safe amalgam removal. All my doctors are SMART certified, which is just stands for Safe Mercury Amalgam Removal Technique. So we use a lot of personal protective equipment, the PPE, around a patient, over the patient, just surrounding everything but the tooth we're working on and ourselves. It's a whole hazmat suit situation when we're removing a silver filling on somebody. So we offer that. And then we offer things even, I mean, there's a lot. We can do microbiome testing the type of bugs that live in your mouth so that we know how to best treat you. We can do biocompatibility testing where we test your blood against all types of dental materials, which will tell us what materials we have in office are safe to use on you. Some people have reactions to things as simple as like the bond we use in a filling and things like that. So we can test for all of those things.
Oh my gosh, my mind is literally blown. I'm like, BPA free fillings? Like, this is next level. It's like everyone who's listening right now is probably geeking out also over this, because I feel like you're bringing a whole new conversation to dentistry that most people have never even considered. You mentioned Listerine, you mentioned oil pulling. Why is mouthwash bad? Why should people not be using that? And talk about oil pulling, assuming that's your alternative.
Yeah, so a couple of alternatives. Mouthwash in general, like the Listerines and Crests and things you can find over the counter at most places, a lot of them are alcohol-based. Alcohol is extremely drying to our tissue. the last thing we ever want to do with our mouth is sterilize the whole mouth, getting rid of all the good bacteria, and the other is drying it out. So those could be the two worst things you could ever do for your oral health. And when people are using like a Listerine daily, it is sometimes our first thing that we're like, stop everything you're doing and stop using Listerine. So that usually, yeah, that's going to wreak a lot of havoc on oral health. As far as alternatives go, there are a lot of good, healthier brands that are coming out with rinses that are really wonderful. Oil pulling is an Ayurvedic practice where you swish like a coconut oil or a fat oil in your mouth. The threshold of having the maximum benefit for oil pulling is 20 minutes. So when people are often coming to me and going like, I oil pull, but like 2 minutes after I brush, and I'm like, it's just kind of a slimy mouth rinse then. It's not a whole lot of good benefits for doing it. The 20 minutes it's an actual like bacterial change where bacteria that are anaerobic, it's more science than would be worthy of talking about, but it's basically an idea that it's getting rid of some of the bad bacteria while preventing killing off the good bacteria. So it is a good alternative. On that note, I will give the caveat that I have a lot of patients who will be like, I make my own with essential oils and things like that. And every now and then I find that people are over sterilizing their mouth with essential oils because we're not often thinking about how potent that wonderful product is. But they can be so antibacterial that you can be sterilizing your mouth just like using a Listerine rinse. So a lot of times I'll steer people away from adding any essential oils to their coconut oil, or if they want that minty fresh feeling like a real mouth rinse, there are a lot of products from Terra & Co. and Kiko is another one that already have some essential oils put in, but it's a small dose in the right amount, giving kind of the better effects of still having all the good effects of the oil pulling without killing off too much.
Oh my gosh, we're gonna have to pull all those links. You said Kiko, and what was the other one?
Kiko and Terra & Co.
And Terra & Co. Okay.
Those
Jotting
are
that
good
down.
oil pulling.
Okay, as a holistic, okay, you're talking about products right now. So what is your like morning routine? Walk us through a morning routine, dental hygiene for your own oral health as a dentist. Like what are some of our must-dos that we have to be doing every day? And maybe even a PM routine, but what's notable?
Yeah, I usually tell my patients the PM routine is actually the most essential for good oral health.
Okay.
In my opinion, because when you go to bed at night, your salivary flow and production naturally decreases with our circadian rhythm. So you are not going to be getting the natural washing off effect, not to mention your lips aren't moving and you're not talking and eating and things like we do during the day, which is actually a natural cleansing for our teeth all day long. So when we go to sleep, we have the bacteria in our mouth have the ability to start to produce what we call a biofilm. It's that like my teeth have sweaters effect that happens throughout the day if you're not brushing and things like that. They lay it on thick at nighttime because there's nothing washing them off. So the best practices are making sure that you're removing as much bacteria, the bad bacteria and biofilm as you can before you go to sleep. So I usually say if you're a person that cannot seem to find the time to brush twice a day, which, ideally you do, but if you don't, brush at night. That's the most important time. Brush at night, floss at night. That's when we really want to get the day off of your teeth before you go to bed. My AM routine, just to follow through with what my overnight routine looks like, I wear an upper night guard, I wear a lower retainer, I wear mouth tape, and that is my
Ask about that.
things. Yeah, that is my three essentials to go to bed in. So in the morning I take those off and immediately brush my teeth, so getting rid of that biofilm that's been produced all night long.
So you should brush your teeth before breakfast.
You should brush your teeth before breakfast and scrape your tongue before breakfast.
Okay,
That's the other place that the biofilm grows the most is the dorsal part of our tongue. So scraping your tongue and brushing your teeth, get that biofilm off first thing in the morning. I usually describe it as don't feed the biofilm breakfast because it will start to wreak havoc. So don't feed it, get it off first, and then eat breakfast.
So good. Okay, I don't tongue scrape, but I do mouth tape. Okay, talk about mouth tape because I need to start tongue scraping. My husband does it, and I'm like, I just need to get on that. But mouth tape specifically, benefits. Obviously, it's like such a viral thing. Everyone's talking about it on TikTok. People are talking about how it snatches your jawline.
Yeah.
But obviously, there's probably benefits other than that.
Yep. Yeah, I love when a health hack has a good aesthetic benefit because then it takes off like crazy.
Right.
I also relate it to like Invisalign. I'm like, I love that it straightens your teeth, but really the function of a good bite is the purpose of it, right? So same with mouth tape. Man, the function, I think this is one of the easiest, simple biohacks that are out there right now. I love that it's trending, and I don't really care what reason it's for because then you're getting all the benefits of it. But the major purpose from an oral health point of view is, again, dehydrating our mouth is one of the worst things we could do. So many people are mouth breathers. When they fall asleep, their jaw falls open, and it's usually kind of intermittent with clenching and grinding our teeth. When your jaw falls open, it actually closes your airway a little bit. So you're not getting as much good airway space. So when that happens, when you can tape your mouth closed, you're actually going to keep your airway space open better than if your jaw were to fall open. You're going to only be getting nitric oxide, or that's how our body produces nitric oxide, is through nasal breathing. So if you cut off your mouth will not be able to produce that same oxygen benefit of nitric oxide. So if we cut that avenue of breathing off, we're only allowed to nasal breathe, we're going to get those extra benefits of nitric oxide for that whole body health, and the oral health benefits of just not dehydrating. Keeping moisture in our mouth is so important.
Okay, this is good. Is there a mouth tape specific brand that you use? Something that you
This
love?
is one of those things that I'm like, there are so many on the market now because it's become such a thing, but I'm also, and you know, the brands may not like me for this, I usually use Johnson & Johnson like medical tape that's in a first aid kit because it works the same. So I'm like, you could make this as easy as possible. I have patients that use Scotch tape. I'm like, I think there's like chemicals and stuff in there, so I'm not sure I'd use Scotch tape, but like a medical grade, you know, no allergenic, hypoallergenic tape is probably a great option. We sell the VIO2 tape, which is just an H form. I do find that a lot of men with maybe some stronger muscles will pop open a one strip tape option. So getting something that has a little bit more girth, especially for like facial hair and things like that, having like one of those tapes that has more tape to it is probably better.
Okay. And can we talk about veneers? Because veneers are obviously something, we're talking aesthetics. A lot of people are doing veneers for the aesthetic benefits. I've thought about getting veneers. I'm still thinking about them. Is this something that is considered holistic? Do you guys do them differently? What is your take on that?
There are such thing as no prep veneers. So I state that first just because there is a way to do minimal damage to your teeth. There is no way to do veneers without some damage to your teeth and some risk associated with it. So I am more of the mindset of no dentistry is the best dentistry if given a choice. I find it really hard to recommend, and I especially don't treat patients who I'm like, your teeth are beautiful and functional, and when I really think that it's only going to cause potential problems for someone, I'm not the dentist for you to do the veneers. There are certain patients who have like enamel issues, like a hypomineralization, that without putting something on their teeth, they are going to get cavities. So there are certain circumstances in which I think a veneer is the right choice for a patient in order to better protect their teeth. But for the most part, even the prepless veneers is adding a foreign substance to the top of your tooth with a etch, a bond. It's creating an area where bacteria can thrive. It is hygienically hard to manage and keep up with, and usually I tell patients your first dentistry on a tooth is usually not your last dentistry on a tooth. So knowing that going into it, if like at some point you will have to get them repaired or replaced or something, I'm definitely not a cosmetic dentist. So I say that in stride of that's not something I usually talk patients into. However, I do find some patients it is a good treatment choice for.
Yeah, no, I mean, it's like, yeah, when you think about it in common sense form, you know, you're doing some type of damage to the tooth. What is that doing to us long term?
Yeah.
You know, and I think this is where I'd love to ask you, you know, you obviously transitioned from traditional dentistry into holistic and functional dentistry. What was that like turning point for you that
Yeah.
made you start to question maybe standard practice? Did you discover something that you were like, was it intuitive thought? Tell us how this happened.
Yeah. Well, I'll give the background history too that I I had a good upbringing. I'm from Asheville, North Carolina. My parents, my PCP was an acupuncturist and herbalist growing up. So, like, I had some foundation here for understanding the importance of alternative medicine. When I went to dental school, I remember being skeptical from day one about a lot of stuff. I mean, as far as dental classmates of mine playing with mercury in their hand, ungloved, like there was so much about what we were doing that I was like, I'm just not sure the safety and efficacy of all of these things. But I followed the rules. I'm a rule follower. I was like, this is the way dentistry is done, and I'll follow the rules. But about 3 years in is when I became pregnant with my first son. And I think the mama bear instinct hits all of us. That pregnancy changes moms. And I find majority of my patients are like in that age range too, because it is when we start to realize that our daily choices don't just affect us anymore. They're affecting the thing that matters most to us. So we start to look into ingredients and everything. That's when I had a day where I think I removed 3 amalgams, and I knew I was pregnant, but my staff didn't know I was pregnant. And I just thought, there's no way I should be doing this. Like, this does not feel safe. So I started to do some research, and as in all things in this health holistic world, once you start to dive a little, it's a slippery slope, right?
It's a nosedive all the way down.
You're just all in. And I just started to realize really quickly that I'm like, this is not safe for me, but especially not safe for my patients. The amalgam was the turning point where I got really scared about heavy metal toxicity, and I got tested while pregnant, and I was really high in mercury, which is obvious because of what I did. So I just started buying my own equipment. I still worked in another office. Didn't really ask permission. I was just like starting to do it myself, of like, let's make it as safe as we can with what we're given. And then the deeper I dove, the more I realized, if I really want to do this the right way, the fluoride free, the BPA free fillings, the offering all of this to so many patients who are wanting it, I'm going to have to open my own. So it was a hard choice because I knew I wanted more kids, and opening a practice while I had kids it was all a lot. But yeah, pregnancy, I think for so many of us, is the turning point.
Mm-hmm. Oh yeah. I mean, I look back and I think if I had my son 10 years prior, or even maybe 5 years, I would have probably done so many things differently.
Yeah.
But it's like that moment I got pregnant, I just started doing research on things. Your instincts really do kick in. And when you listen to them and you tune out the noise, I can attest to that. And I think that's a great segue into talking about, obviously, our littles and their mouths and taking care of them. One of the biggest debates, I think, in dentistry is probably fluoride. I mean, can't think of anything else. You might be able to tell me, but I think that, when I think about what am I going to put in my child's body, or what am I going to use on him, then it also makes me start thinking about, well, yeah, like if I'm pregnant, or just what about my health in general? So can you talk to us about your perspective on fluoride? Is it something we should be avoiding? Is there a safer alternative? What's your take on fluoride?
Yeah. I think I mentioned before, there are some controversial topics in dentistry where I'm like, I can argue both sides, and I understand what we're trying to do in traditional dentistry. Fluoride isn't one of them. I don't think there's any reason that we should still be trying to stand behind fluoride. It is without a doubt, a toxin. Our toothpaste has a poison control warning on the back. Always has. There's no doubt about it. Nobody is arguing that there is a toxic overload of fluoride if you consume too much. And it is impossible to regulate how much an individual consumes when it's in our water systems and it's in our toothpaste products and all of that. So yeah, the fluoride to me is, I think it's going to die. I don't know when it will, but I do think it's going
Me
to.
too.
And yeah, I
Soon.
think if you're paying attention to the news, it's probably going to come out of our water systems, which is great. I don't use and never have used fluoride on my kids. As far as like children's oral health goes, yeah, a pregnant mom using fluoride, it does cross the blood-brain barrier. It will get to your baby if you're using fluoride toothpaste. And I don't ever want to scare moms about that. I'm just usually like, hey, there's a million moms that have used fluoride before, and everything is going to be fine, but now you know better, so let's switch you. Let's get off of it. And Hydroxyapatite is what our teeth are naturally made of. So that is a kind of a buzzword in holistic world and holistic dental world right now, because they're adding it to so many good products so that we can remineralize the tooth structure. I also talk to a lot of moms who are like, I don't even want to use that. And to me, my point is, depending on you and your teeth and your circumstances and your kids' teeth and their circumstances, sometimes you don't need it. You don't need a remineralizer. If your teeth are in good shape, you haven't had dentistry done, and ideally our kids are coming out perfect, right? And we have a blank slate to start with, we can avoid using anything if we're doing really great hygiene tactics. So still using, something cleansing or getting plaque and biofilm off the teeth is still a super important thing in our kids. Diet to me is the kids' issue. If you're not following a good diet protocol, then you probably want to be introducing a remineralizing agent into both you and your kids' daily habit. So my kids use hydroxyapatite toothpaste. Risewell and Dr. Jen's are two of our favorites. I will probably headlock my children until they leave my house and brush their teeth for them at nighttime, because that is just, I know the hygiene portion of removing the plaque is just the most important part. So that is something that I try to pass that information along to other mothers. If like a teenage boy is probably never going to be doing the job that should be done to clean their teeth. And so I will probably try to have a hand in it as long as I can to prevent those things that they're not thinking about at 16 years old or 5 years old or whatever it is. Seeing the dentist really at like first tooth eruption is important to me, but it's only important to me because of the education component. So I say that because it may not be a just see any dentist, but see a pediatric dentist. And even if they're recommending fluoride, it's really easy these days to say, no, thank you, not interested, but still go for the educational part of it. I think a lot of my patients are fearful of fluoride, so they avoid the dentist for their kids, and they don't get the educational components, which is breast milk causes cavities, and are you wiping your baby's teeth clean before they go to bed? So there are certain things that I find without that educational component, you might be setting up your child to have some issues later on. So I say it's totally worth going. Get the educational component, learn about good oral practice hygiene routines, and you can always say no to fluoride. But there's also a lot of great practitioners who don't use it.
So wait, you said breast milk causes cavities.
Breast milk has a lot of sugar in it, and you can get breast milk cavities. Babies get them all the time.
What? Okay, so what? Okay, back up. So as a parent who is trying to practice, obviously you said you may not have a holistic pediatric dentist in your local area, but you want some education around the right practice of how to take care of your baby's teeth, your children's teeth. What are some top things that parents need to know? How long should they be brushing for? What's an ideal toothbrush that you recommend?
Yeah.
We have like a little electric one for my 3-year-old, and we have a little timer, and we do the timer and we make it like a whole fun thing. Otherwise he's going to try and run away, and
totally.
we're like, this is what we got to do to take care of your teeth. But what do you say as the holistic dentist? What are you telling parents? I want to know.
Yeah, so the breast milk part, and again, the reason I'd be like the first teeth, because if you're breastfeeding, and again, my population is like breastfeeding till 3 sometimes. So if you're feeding throughout the night, when I was just explaining all that lower salivary flow, you're potentially leaving the sugary substance on the teeth while they're sleeping. So the on and off nighttime feeding, long-term breastfeeding is when we typically see a lot of the breast milk cavities. So
Interesting.
Yeah, it is important to wipe the teeth clean. And I kind of joke about it because I'm like, oh yeah, the dentist in me is like, use a slightly damp washcloth and wipe those teeth clean right after you're breastfeeding. But the mom in me is like, and wake my baby with some cold water. Where did I get this washcloth in the middle of the night? And like, I have all those questions. So I'm also like, use whatever you got and wipe the teeth off. Like sometimes it's the sleep sack, and I just like scrub my 8-month-old daughter's teeth right before I put her down. It's just the idea of removing that biofilm before they go to bed or before they go back to sleep that's so important. So that's the little breast milk point. Yeah, any gimmick you can do to make it fun for your kids is super important. There's a lot of great pediatric dentists and holistic pediatric dentists online. So I just always recommend people find some of those accounts, watch them do like how they make teeth brushing fun for their kids at nighttime and make it happen. If your toothbrush lights up great, I use a Sonicare toothbrush or a sonic producing toothbrush on my kids as early as they'll tolerate it, because sometimes I'm not in there as long as I'd like to be. They won't let me stay in and scrub. So I'm like, if I'm getting the sonic vibrations, I know I'm able to remove the plaque faster. So really by like 2.5, I think both of my boys were using a Sonicare. My 8-month-old daughter is using, the end of her sleep sack.
I love it. There's a song, it's by Raffi, Raffi, and it's called Brush Your Teeth. Literally, I cannot tell you how many times we've played that song. It's in my head for sure, forever. It's imprinted at this point in my brain. But we'll play that in the bathroom. I have a timer. We do a whole thing because I'm like, I just got to get this kid to brush his teeth because he's a boy. He wants to run. He just wants to jump on the bed, So
and they want to chew on it and run with it. Yeah,
we do a whole thing. We play. It's a whole thing. But I love that just around using the electronic toothbrush because we introduced that to him and we just noticed. Like, honestly, I think it's, like, soothing for them, too. Like, I think that, like, vibration for little kids, like, they, like, think it's fun. And he's like, what is this thing? And it looks like mommy and daddy's. So I think they think it's fun. Yeah.
As long as you don't mind, like, my kids are in charge of brushing their teeth in the morning as they get a little older. I do the nighttime. So as long as you don't mind the mess, mirror mess of it all.
Whatever.
Yeah. I'm like, I don't mind the mess as long as they're brushing their teeth. So
what are some foods that are, like, a nightmare for kids? Yeah. Teeth that cause cavities?
I mean, this one's always hard because I hate making moms feel guilty. I think it's the worst, but I think goldfish crackers are probably the worst thing in the whole world for kids.
For many reasons.
For so many reasons, but it is such an easy snack, and I always tell moms that. I'm like, I know it's a non-mess making. They can have it in the car. It's easy. They love it. I get that it's easy and it matches all of those things and it's cheap, but it is a simple carbohydrate that sticks in every nook and cranny of a tooth, and kids that eat them often. So they're getting that splash of simple carbohydrate in their mouth all the time. I just stand by, because I see goldfish crackers all the time. I'm like, I just feel like there should be a public service announcement about goldfish crackers.
What about all crackers? Are all crackers pretty much in that category?
Yeah, it depends. Simple Mills, there's some that are almond flour that are not that same simple bleached carbohydrate that is a much harder thing for bacteria to turn into an acid. So the idea is the sugar feeds the bacteria that creates the acid that causes the cavity. So if you're giving them simple sugars, they're having a party. If you give them complex carbohydrates, they can't really break them down fast enough to create the same party, and they don't stick like glue usually, like a gluten wheat based bleached flour does.
What are some top foods that you would love to see moms give their kids that makes healthy teeth, that makes a healthy microbiome?
Yeah, I mean, not only microbiome is a big one in the sense that fermented foods, if you can get your kids some fermented foods, that's awesome. My kids love sauerkraut.
So does my toddler.
Yeah, we just put that on the side of so many plates of theirs. It's such great probiotics for them. I sometimes harp more on hard and crunchy foods because it is so hard for us as moms to realize when is it safe for us to be giving giant carrots and sticks of celery and hard steaks to kids who might have a choking hazard. And I try to remove that fear and remind them that the chewing hard is what helps our jaws develop. So if we're only giving soft foods, our jaws are not told to develop strong, healthy bone because they're not having to break down anything strong and crunchy and tough. So it's really important from a young age to have some of those. And obviously whole foods is, anybody in the holistic world is what can you give that's whole foods? But that really is a lot of crunchy foods, apples and celery and carrot sticks, and things that make the jaws work will also make the jaws grow.
Let's actually talk about jaw development. That was on my list to ask you because I I see this conversation around more and more kids needing braces, expanders, airway treatments. There's devices like the Myo Munchie.
Mm-hmm.
You know, we hear the buzzwords of mouth breathing. My son, we do a Myo Munchie with him. This little, if
Yeah.
you're listening, it's this little like silicone device where he can chew on it. But what do parents need to know about how to help their kids have, proper development of their jaw, of their airway? Like what
Yeah.
can you give us, especially I think like what you mentioned around all of our foods are soft, and I see that as like parents don't, it's easy to give your kid a pouch,
Yeah.
but I've learned so much with my own son's experience. I'd love to hear your expert opinion on it.
Yeah. I mean, I love all things myo. Myofunctional therapy is something dear to my heart for a lot of reasons. I also like to state that this is a generational problem. This is like an ancestral happening over the last many, many decades. So even if you do all the right things for your kid, the ancestral part is their jaws may not develop the way they should because we have had too soft of a diet for too many generations. And you can't change that overnight. And it's really frustrating for
Wow.
moms who are like, but I got the tongue tie release and we did the myofunctional therapy. And now you're telling me we still need to do airway expansion and braces. And I'm like, yeah, because it's generational. I mean, it's so frustrating. But what I try to encourage is you're improving for your great grandkids might see the benefit of this, but it is really frustrating. And I'm hoping it's going to be a turnaround that will have better jaw development as we start to reintroduce more ancient practices of hard, crunchy foods and things like that we're supposed to have. But the idea is we're losing jawbone development because of it. And when we lose the jawbone development, we're also losing airway space. It's unfortunate that like so much of our life force is just like right in the same area. And so when you have underdeveloped jaws, it falls backwards into your airway space. So we are seeing it's a huge problem. We are seeing so many kids that are having growth and development issues and are needing things like the tongue ties, the myofunctional therapy. And for your listeners, myofunctional therapy is just like physical therapy for the muscles of the mouth and face. And it helps you learn proper tongue posture. When we put that strong muscle in the right spot in the roof of our mouth, it will help develop the jaws the way it should. Anybody who's had a thumb sucking kid knows how a simple habit like thumb sucking can change the entire outcome of what a kid's mouth develops like. So that's how simple even just changing the posture of your tongue can develop a different jaw than not having good posture of your tongue. The Myo Munchies is something that is a tool that helps guide that, put the tongue in the right spot, put the jaw in the right spot for proper downwards and outwards growth of the jaws to give the best airway, to give proper jaw development for good functional orthodontics where our teeth are supposed to meet up. But unfortunately, yeah, you might still end up in expanders and braces.
And I think that's encouraging actually, because I think it's like when moms are constantly trying to do everything they can and check every single box, and they're doing all the things and they're doing the exercises, and they're like, oh, it wasn't enough. It's like maybe it actually wasn't all supposed to be on you, and it's okay to go and see a holistic dentist and get some help and have to do some of these things. That doesn't mean that you failed as a mom. It just means that you're using the resources
Yeah.
that are available. So I think that's actually very encouraging.
Yeah, those steps will all help too. It's not like you're
Yeah.
going to do all of it and end up in the same spot even if you didn't do it. They will help.
Yeah.
But it's just, I know it's defeating when people are like, but I did all the prep. And I'm like, yeah, but genetically,
That's
you
good.
might be growing smaller jaws. So,
Yeah. So crazy.
Mm-hmm.
What is the number one thing that you wish people understood about their dental health, but they probably don't?
That's a good one. I think my big take home for a lot of patients, and these are actually people who maybe don't go to the dentist, is more that you can't have overall wellness without oral wellness. And I think a lot of people so again, in all the right mindset, we're doing everything we can with nutrition and making a lot of mindful choices in our life, but might be scared of the dentist. And so we avoid that portion, but it's connected to our whole body. Not having a healthy mouth will affect your overall health. So I just encourage people who, I don't blame anyone for having trauma surrounding dentists. It is tough. But if you find the right dentist and you find a safe space and at least feel like you get educated, a good dentist could put you on a plan where you only need to go once a year or once every other year. If you have all of the right tools and tricks to take care of your teeth, I'm not saying you're destined to have to see us every 3 months or things like that, but it's so important to gain that sort of knowledge so that you can have overall wellness, because things like gingivitis and cavities are diseases that chronic inflammation, like we talked at the very beginning, chronic inflammation leads to chronic inflammation. And I wholeheartedly believe it can lead to things like cancers and autoimmune diseases and things that can be totally preventable. And the mouth is a big organ for us, so we should be mindful of it.
Oh, that's so good. I'm like, my brain just goes straight to like, you know, your mouth is like the start of your gut, your like whole system. And if you know, you could be taking all the probiotics in the world, but like if you're not addressing this, you know. And I will say too, for anyone who has dental trauma, because I had a lot of dental trauma. I grew up with like a one tooth came in behind another tooth. I had to get a tooth removed when I was in college. I had an abscess tooth in college. I've had so many dental issues, and there is a difference between just going to a regular dentist and going to Sweet Truth. Like when you sit at Sweet Truth, you're like, oh, this is vibey. The waiting room is like a vibe. You know, you guys have like the products set out so aesthetically. You know, everyone's so pretty and nice who works there. Like you guys have such a great team. So I think like obviously not all of our listeners live in Nashville, but if you search, you know, and I know that there's probably some like dental deserts out there where there's very limited access to, you know, depending on where you live and where you're located, but maybe just like, you know, you don't have to go to that one dentist that maybe it wasn't a really great experience, and you could go and find someone else or, you know, ask around. But I just can't speak highly enough of my experience that when I went in, I was like, I didn't even know a dentist's office could exist like this. So hopefully more dentists take note.
Thank you. I do feel like the functional dentistry is taking on, we in particular are just trying to take the dentistry ick out of the dental experience. So we're trying hard to make it feel like it's a self-care moment, not just sterilized health environment.
Yeah, it's like, it almost feels like when you walk in, it's like, I'm gonna get a facial today. I'm pretty sure I'm getting a facial. Like that's kind of what the waiting room feels like.
Misting to the face, it's almost like a facial.
Right. If there was one small change that our listeners could make to improve their oral health, what should they do?
It's a tough one because I am just like, I drive home this, it's not one size fits all. It depends on the person. What is your mouth? What are your problem areas? And let's give you that. But I think a big one for me that's just such an easy hack is one we've already talked about, but it's mouth taping. And to me, because it's not just helping your oral health, but it helps the whole body health, I'm like, this is such a simple button to push. This is not a huge habit. It's such an easy thing to do while you sleep. Like habit stack your good sleep hygiene with good nasal breathing, and it's a game changer for me if I'm breathing through my mouth, if I get sick and then I mouth tape to like re-get that nitric oxide push. It's wild how much better you can feel with that. And I know it's so beneficial to oral health too.
And actually that's a question I had for you, is do you recommend doing any nasal rinsing so that people do breathe really well through their nose instead of mouth?
Yeah, great question. And it's why that I'm like, make sure you get an airway evaluation before you tape your mouth shut so you don't suffocate. Like, yeah, there's that. But I definitely, there is like xylitol mouth rinses or nasal rinses, I'm sorry, that are really good.
And those before.
Yeah, those can clear the nasal passages a lot. But tons of people have deviated septum. So that is sometimes part of it. And I know people learn to live with them, but like learning to live with that sort of thing that's keeping you from optimizing your health is kind of like, it's a pretty simple fix in the ENT world to get your deviated septum fixed. So I'm like, we should evaluate. We actually have a machine in my office that can measure the volume of air that can pass through each nostril. So we can
I'm coming in to do that. Oh my gosh.
So if you have a totally blocked nostril, we will find out and we can get you to an ENT to get it fixed.
That's mind-blowing.
Yeah.
I truly feel like that's life-changing because like you said, when you know that feeling of when you go to sleep and you can't breathe out of your nose, you wake up that next day, you feel hungover. And I mean, I've also heard a lot about how under eye circles, like if you're getting under eye circles, it could be related to the mouth breathing.
Yep. definitely. I find it true to be in my kids, especially like when they've had a cold and they've been mouth breathing all night. You can tell like their dark circles are really rough for a while until they get back to nasal breathing.
Oh my gosh, yes. And bless every parent who has to do all the nasal rinsing. We do that with my toddler, and we do the nose Frida and all that stuff. And it's hard work, but to just get them to be able to have a good night's sleep and be
Yeah.
nose breathing, it's so worth it. Amazing. Dr. Poole, where can people find you? Where can they follow
Yeah.
along? If they're local to Nashville and they want to come into Sweet Truth Dental, what's the best approach for them to do so? Give us the tea.
Yeah, sweettruthdental.com is our website. We are also on Instagram. I was just going to say, if people do not have a holistic dentist in their area, and there are some directories, you can look us up, but following holistic dentists on Instagram can give you so much insight into what you need to know. So ours is sweettruth.dental is our handle on Instagram. We have office in Brentwood, Tennessee, so just south of Nashville here. We are opening our Nashville office, so our second location. I know we're very excited. It opens probably like 6 to 8 weeks, so we're getting really close to that one. So yeah, we will. That one is, if you're local, Top Golf. It's like right along the riverbank there on the east of the river, so kind of East Nashville, but walkable from Germantown and things like that. So we're excited to get more holistic dentistry to more people.
That's amazing. I'm so excited for that.
Thank you.
Thank you so much for being on the show, giving us so many tidbits. We're all going to be mouth taping now.
Yeah.
And if you're local, hit up Dr. Poole. You guys have to go in.
Thank you.